I support Gateway because of our mission, to shape a world in which a cancer diagnosis is no longer feared. I love a lot of things about Gateway. I'm excited that 99 cents of every dollar we receive goes directly to our mission of funding clinical cancer research trials. And I also like that we have a singular focus, which is to help today's cancer patients live longer, feel better, or be cured of their disease today.
Cancer is relevant to everybody. The thing about cancer is that it's a disease that doesn't discriminate. Most of us have had cancer impact us in some way, either directly or indirectly. And if it hasn't, it could at any time.
I lost my dad about 5 years ago, and one of the things that I struggled was with not knowing what was going on with him. You know, there's a series of triggers of events the doctors couldn't explain, and it just made us feel, especially me, completely helpless. Because, you know, with knowledge, you're able to empower yourself. You're at least able to understand what's going on. You know, and there weren't really answers.
Your work with Gateway really does make an impact, and you can see it because patients have a voice. You know that the work that you've done has gone to really help someone live another day, fight another day.
With proper funding and education and focus on the early clinical trials, I think it's important cancer research, and it's a differentiator between a lot of other charities that I think is important.
I received a cancer diagnosis in 2001, and that's a day that changed my life. The initial diagnosis brings a lot of fear and worry about the future, and shaping a world in which that diagnosis is no longer feared would mean that so many more cancer patients, when they get that diagnosis, don't feel like it's the end of the world.
It was, I remember one moment just getting out of my friend's car, and I felt like just this awful pain, and I knew that it couldn't just be, you know, a pulled muscle.
It was when Maddie was diagnosed with the cancer. Her team approached us and, you know, explained to us fully about the clinical trials, what it would entail, you know, what Maddie would have to do. And honestly, it didn't really have to give it much thought. It didn't make sense not to do it. So we spoke about it with Maddie briefly, but we were all on board with it very quickly.
Like most childhood cancers, the goal of our treatment is not necessarily to prolong survival, but to cure them of the cancer, and that's certainly the case with osteosarcoma. So our goal is to allow patients who develop this cancer to live a full and normal life after they complete their treatment.
I'm very happy to be part of Dr. Bayless's clinical trial because I know it's helping many kids in the future.
I'd recommend it to other people just because of the amazing outcome, just like it should be a norm. It shouldn't be a last resort. I was a part of the trials that helped create people to not be scared anymore. Cancer can be cured, so I think I would feel very, very happy that I was part of it. From what I did, I hope that other people can just really benefit from it. I hope that my results from the trials really do make a difference.
Clinical trials like this that are done at a single institution that use a novel design in a relatively small population are generally not supported now by federal research funds, but they're very important in terms of looking at new ideas, new approaches to treating cancer that aren't necessarily on the radar screen in the large cooperative groups. And so for foundations like Gateway to completely support a trial like this, to provide support for all the resources, the personnel, the lab testing that's needed to conduct an intensive study like this is critical for us to develop new approaches and new treatments for these diseases, both in children and in adults.
It's a very, very hellish journey, and one that nobody should really have to go through. So if this could be a thing of the past one day, that would be wonderful.
I got to go back to the beach, which I completely missed the year before that because the whole year it was actually 4 months during the summer. So it was 4 months on my back during the summer. So the one thing I missed was, you know, the sunshine, the beach, and I finally got to do that.
To see her now being a normal 19-year-old again is wonderful. Very, very grateful to be where we are today.
I'm living proof that it does work. And I would just say, keep doing what you're doing, and thank you so, so much.
$20.75 a day to fund a patient is a very low point of entry to get involved in such a great charity. It's a minimal amount of money and it makes a huge impact.
For the cost of coffee for a week, you can really help someone.
It doesn't have to be hundreds or thousands of dollars. It can be the cost of your dinner and you're already making a difference in someone's life.
$20.75 means I'm not getting a manicure and I'm funding a day of a clinical trial.
If you just think about it, like donating that one day to that person, maybe they'll one day be healthy enough to get out of the hospital and go to the movies with their family.
I love Maddie's story, and I love watching the transformation of her, and I'm so hopeful that there will be so many more patients like Maddie thanks to research that the Gateway is doing.
When I look at Maddie, I think of all the possibilities that we've created for her and that we've created for a generation of people. I look back at my daughter and, that could be her.